Failed intubation response. As I said, anytime if you recognize that the intubation is not happening, so till we have discussed about successful intubation. Now the intubation, you're able to visualize the cords, number one. Number two, you're able to visualize the vocal cords, but you're not able to pass the ETT. You have passed, but it is causing trauma and it's more bleeding, and you're it out, but not able to visualize. So there are any number of ways, reasons intubation failed. But the most wise thing to do is identify early, sooner, so that you will be able to risk the oxygenation. So oxygenation with bag mask ventilation, stop the attempts, maintain the oxygenation with bag mask ventilation, insert the supraglottic airway device. Okay, so now you have declared that the patient, you're not able to intubate because of trauma which has happened while inserting the endotracheal tube or trying to in the endotracheal tube. There is a trauma or some laryngeal edema or a laryngospasm which has happened. Once you start try to oxygenate, you're not oxygenated well. Now with supraglottic airway device also or mask ventilation also, after you tried intubation, now you're able to ventilate. Imagine there's a patient who was unconscious. You have decided to intubate the patient. You have initiated with bag mask ventilation. You have maintained the ventilation well for 3 to 4 minutes. Everything, all the equipment which is required for intubation has been arranged. Now you have when the rocuronium, and then the patient is relaxed. Now we have put the laryngoscope inside. You've got a nice vision of the vocal cords. You have tried to insert the tube, but now you could not insert because the access is wrong or something. Then again you have tried trauma to the vocal cords or the vocal cords. It started to bleed. The blood is filling up there. You try to sort, but it is bleeding further. Now you realize this situation is filled. You start to ventilate the patient back. So now put the bag mask ventilation back. You give a good jaw thrust and seal it and try to ventilate. Now you are not able to ventilate because that trauma has caused laryngeal edema, and now the air is not passing through the larynx. And now you have picked up a supraglottic airway device. You have inserted the supraglottic airway device, and even with that, able to ventilate, then oxygenation.